Welcome to our friends from around the world and here in the United States for this online webinar. And it will be titled, Examining Saudi Arabia's Global Humanitarian Aid and Relief Programs, a conversation with Dr. Abdullah Rabeeah, advisor to the Royal Court and Supervisor to the King Salman Humanitarian Aid in Saudi Arabia. My name is Delano Roosevelt. I'm the president and CEO of the National Council on U.S. Arab Relations. And today, I'm very pleased to welcome back for the fourth time, I might add, His Excellency Dr. Abdullah Rabeeah, advisor to Saudi Arabia's Royal Court and Supervisor General of the King Salman Humanitarian Aid and Relief Center, headquartered in the Kingdom of Saudi Arabia. I want to express my thanks to the staff at KS Relief, and I'd like to also thank my staff at the National Council for all of the hard work in making today's event possible. I would like to also express my personal heartfelt appreciation to His Excellency Dr. Abdullah Rabeeah for accepting our invitation. A little bit about His Excellency, and if it looks as though I'm reading this, because I am. With his background and his achievements, I don't want to get this wrong. So if you'll indulge me. His Excellency serves as an advisor to the Royal Court of Saudi Arabia and has also served as the kingdom's Minister of Health. In addition to leading KS Relief, Dr. Rabeeah is also known as a world-renowned surgeon known for his specialization in high-risk and complicated pediatric surgeries. Dr. Rabeeah has been Supervisor General of KS Relief since its inception in 2015 by His Majesty King Salman bin Abdulaziz and the Crown Prince, His Excellency Mohammed bin Salman. Under His Excellency's guidance and leadership, the King Salman Humanitarian Aid and Relief Center has become an international model of excellence for the provision of humanitarian aid. It has emerged as a significant force in global humanitarian efforts, providing vital assistance to millions of individuals across 55 countries. The Kingdom of Saudi Arabia has a long-standing tradition of supporting those in need. Now, KS Relief embodies this commitment, actively working to alleviate human suffering, safeguarding human life and dignity. Also today, joining His Excellency as our moderator is our own Colonel Abbas Dahouk, retired U.S. Army retired. Colonel Dahouk is a member of the Council's Board of Directors, I am proud to say, and served for 35 years in the U.S. military. Colonel Dahouk was a senior military advisor to the Bureau of Near Eastern Affairs at the United States Department of State and proudly served the United States in the capacity of Defense and Army Attaché to the Kingdom of Saudi Arabia, representing under 3 consecutive Secretaries of Defense. He is also the founding president of HyphenPoint, LLC. HyphenPoint is an international strategic consulting firm focusing on mutual strategic issues and concerns for its partner clients and organizations. Colonel Abbas is also a trusted television personality and is frequently is a commentator and a guest on Arab satellite broadcast networks. Colonel Abbas, the floor is yours.
Well, good early morning to you, Del. Thanks for the introduction. You're actually joining us from Los Angeles or San Diego area, so it's very early for you. And good day and welcome to all our viewers near and far. And good afternoon to you, Dr. Abdullah. As you know, our purpose today is to provide an update on your organization, KS Relief, update on achievements since our last webinar over a year ago. So since then, we see the turmoils and instability and wars that's on the rise, whether it's in Ukraine, in Sudan, Africa, or obviously in the Middle East. And with that, we see that the humanitarian aid is more vital than ever. So it's a very key component to provide some stability. And we still see KS Relief is at the forefront of this and a leading force in this endeavor. So again, I'll join Del and thank you for joining us on behalf of also the chairman, John Pratt, and our members of the board of directors. We welcome you to come and share your expert insights and your experience with the organization's initiatives and accomplishments. So with that, I pass the floor to you to provide us with your with update, and we'll be followed by Q&A after that. Dr. Abdullah.
Thank you, Your Excellency, Mr. Delano Roosevelt, the President and CEO of the National Council of the U.S. Arab Relations, and also Colonel Abbas Dahouk, Excellencies, ladies and gentlemen, our viewers on the webinar. I really highly appreciate, number one, the invitation from the National Council of the U.S. and Arab Relations, and it has been always a pleasure. This is the fourth time. Each time I enjoy it a lot because of the stimulation and dialogue that exists from this webinar. I will take your permission to present a PowerPoint presentation and for some time, then we'll be happy also to open the dialogue with you after that. So allow me to put the slides on and we'll start from there. And as you mentioned, Colonel Dahouk, that since our last presentation, there has been a lot of changes in the region and beyond, which has really stimulated the discussions today that will also show how much need for the humanitarian work. I have modified the title since we are celebrating within a very close few months a decade from KS Relief. So I called the presentation A Decade of Unrestricted Humanity, if that's acceptable by you. And we will move to the next slide. So this is not moving. Yes, I think there is a technical issue, but we'll correct it in a minute. But anyway, KS Relief is celebrating its 10th year anniversary early next year, and we will address it later on in the presentation. So let me just tell you something about KS Relief. And KS Relief and actually the Kingdom of Saudi Arabia since 1996 till today has spent over 130 billion US supporting 170 countries globally. And when we talk about KS Relief, as has been indicated in the introduction, it has been actually inaugurated by His Majesty May 15, 2015, and with a vision to become a leading center for relief and humanitarian activities, and also transfer our values to the world, and also to manage and coordinate our relief activities on an international level to ensure the provision of appropriate external aid. Now we have certain values that goes with the international benchmark, which is impartiality, transparency, quality and professionalism, and to have initiatives and creativity, and also our aim is to build partnership and also supporting communities. The governance is very important when you talk about aid organization, especially now the importance of having very clear digital governance to avoid any misuse of the money, whether it is government or private sector money. And that's why we have a very strong financial monitoring departments. We have also a very rigid humanitarian charter. We have a compliance and audit department. We have an external auditor. We have a project management departments and many other departments to ensure the strong governance in KS Relief. As we believe that our work is all external, and that's why we have branches that represent the continents and the region that we work in, like a branch in Turkey, in Pakistan, in Somalia, in Afghanistan, in Jordan, in Yemen, and in Lebanon, including 2 smaller branches in the Kingdom of Saudi Arabia. And as an organization which has wide spectrum of duties, we work in all the 13 sectors of humanitarian work, which includes, as you can see, volunteering, protection, health, nutrition, education, early recovery, water and sanitation, shelter, and emergency and humanitarian coordination, and also multi-sector work. In KS Relief, since the inception of the center, we have implemented 3,900 projects in 100 countries with a budget approaching $7 billion. So there is a lot of work happening in KS Relief. And as you would imagine where the crises are, we have Yemen, Palestine, Syria, and Somalia on the top, and we have added Ukraine recently to those priority centers. And I just want to take you to the special programs and initiatives that we have taken in KS Relief, which stimulates the humanitarian workers globally. First of all, we believe that if we empower women, we will empower the societies, and that's why KS Relief is a women-focused organization with more than 992 projects directed to women, reaching close to 151 million women globally, with a budget approaching or exceeding $650 million in many programs, as you can see, to empower women globally. Also, children are the future of the nations, and that's why we want to focus on children with more than 926 projects, reaching close to 180 million children globally, with a budget approaching $900 million in areas which are very important, which is education, nutrition, and creating opportunities for children so that they will enjoy their life, whether they are refugees, IDPs, or in disenabled communities. One of the projects that we are proud of, and I'm sure Colonel Dahouk knows this very well, landmines are extremely dangerous, especially in countries with conflicts like Yemen and other areas. And that's why KS Relief also is working to demine countries which has been subjected to conflict. Massam land mine clearing project in Yemen so far has cleared close to 500,000 landmines. We have very capable 400 professionals, and also those professionals are educating the Yemeni staff so that they will be able to continue the work in the future. Also, one of the projects which is comes in parallel with the demining project, which is the artificial limb project, which is also, we have so many projects in Yemen and in Syria and many other countries that children, women, old people have lost their either life or their limbs because of those landmines. And that's why we have created many centers in Yemen and elsewhere to put prosthetics and try to regain the capabilities of those communities so that they'll be valuable members of their society. More than 67,000 beneficiaries of this program. Also, one of the programs, which is one of the premieres of KS Relief, is the reintegration of children that have been associated with armed conflict. And we have called this program is KAFAK. This program is very close to the UN, and they have always supported this program because, as we all know, unfortunately, in conflicts in the region and beyond, children have been actually associated in the front line of the conflict. And that's why we have taken thousands of those children, trying to rehabilitate them from the psychology point of view, educational, family, so that they will become a very useful children for their society and try to avoid using them as future terrorists. There is no question that education for children is the way to peace. And also, we should not forget children with disabilities, that their education and their mental support is equally important. Also, KS Relief believes in digitalization and artificial intelligence, and that's why we have created so many platforms to make our work digital. We have the Saudi volunteer portal, which actually takes care of the visitors in Saudi Arabia, or refugees living in Saudi Arabia, and also the refugees outside the Kingdom of Saudi Arabia. Also, we have the donation platform, which is the Sahem platform, which actually makes the donation extremely easy and digital and easily audited. And also, we believe in transparency, and that's why we have Saudi Aid platform, which enables anybody who wants to see the aid of Saudi Arabia. We have a platform which is called Saudi Aid on our website, where you can see all the aid of Saudi Arabia, clearly transparent to which country, which zone, which area, and which sector of the humanitarian work. Saudi Arabia, contrary to the misbelief, we do have actually refugees in Saudi Arabia. We do not call them refugees, we call them visitors. In respect to them, they live and they are integrated in the society. We have from Myanmar close to 270,000, from Syria close to 262,000, and from Yemen above 560,000 living in Saudi Arabia, making a total above 1 million, which represents above 5.2% of the Saudi nationals. We actually also support refugees outside Saudi Arabia by many important programs, whether they are related to health, whether it is related to also nutrition, or actually enabling women and also the youth by creating opportunities and jobs for them in the future. We are actually proud that we are one of the largest organization that provides a volunteer program. On our actually volunteer website, we have actually thousands of young Saudis, both men and women, who have enrolled in the humanitarian volunteer programs, and we take them, train them, actually teach them about the law of humanitarian work, and also we provide services to the world, for example, either in the sports for refugees and IDPs, whether creating opportunities and actually skills for refugees and IDPs so that they will become a very useful members of their societies, or by providing health programs, which is the largest of our volunteer convoy programs. And we have actually more than 365 medical volunteer convoys a year. Literally, we have a convoy a day in areas which are very important, like open heart surgery for children, open heart surgery for adults, bone surgery, children's surgery, cochlear implant, which I will address later. Now, both of you, Mr. Roosevelt and also Colonel Dahouk, mentioned the current crisis, and I totally agree with you. We live in very actually difficult current crisis, and that's why they took the priority in our work. Gaza comes in the top line of the crisis. And from day one, when the crisis in Gaza occurred, the Kingdom of Saudi Arabia, through case relief, has responded. Number one, by actually His Majesty called for a national fundraising campaign, and the King and Crown Prince started themselves by donating. And we have to date $185 million in the actually fundraising campaign, in addition to the fund that has been provided by the government, making money available from day one. And the fundraising is still going till today. We have to date more than 54 planes which is an air bridge to carry both food, medical supplies, and shelter supplies to the people of Gaza through both Arish and Rafah. And also we have used the sea, also more than 8 ships. And recently, with the coordination of the Jordanian Air Force, we have utilized the airdrop program. And now also we are discussing with our partners in Jordan also to utilize the other routes to enter Gaza, since Rafah corridor is closed now for more than 6 weeks. Now also we have used our very loyal and important partners from the UN, like UNRWA, WHO, ICRC, and also WFP, all of them, and other partners like the Red Crescent of Palestine, Red Crescent of Egypt, to support them with actually financial support in order for them to reach the people of Gaza. Also, more than 423 trucks have gone through the Rafah corridor, and we have another 400 trucks waiting to be allowed to enter through Rafah corridor. And also we have donated to date 20 ambulances to help the health authorities in Gaza. These are the routes that we have utilized to help the poor people of Gaza, trying to maintain the minimum basic requirements as much as we can. Sudan is another crisis area, which is equally also difficult and challenging. And today we have a budget of more than $120 million. And we have utilized both the air and sea routes, more than 19 planes. And the sea route, we have provided food, shelter, and health projects. In addition to that, we have signed projects with also the UN and actually international agencies like the ICRC, WHO, WFP, and UNHCR. Let me address the ICRC program. This is a jointly funded program between the Kingdom of Saudi Arabia and the United Kingdom. We have started actually a government-to-government joint funded programs through a global partner to increase the impact of aid on the affected countries. We have done it with the USAID and also with the FCDO from the United Kingdom, and also considering it with the European Union. These are the modes of transfer to Sudan. Ukraine, another crisis also zone, which is also having a major humanitarian impact. And the kingdom has responded by a budget of $400 million, 300 million to the oil products based on the request from Ukraine, and 100 in the pure humanitarian aid. We have, in addition to that, supported the Ukraine refugees in Poland with 2 programs through our partners, both WFP and UNHCR, with 5 million each. And I myself have visited actually Poland and have met many of those refugees. We have used actually, because Ukraine is far from us, we have used the air bridge program and also the direct purchase program from Europe to Ukraine. We have more than 21 planes have taken shelter items, health items, and baby formula for the children of Ukraine. And also we have sent up to date 125 ambulances to support the Red Cross of Ukraine. We are based on the request of Ukraine, we are signing a joint programs with WHO and also UNFPA to support the people of Ukraine inside Ukraine. And these are the routes that we have used for Ukraine. In Turkey, as you know, all of you know that the massive earthquake that has affected both Turkey and Syria, we have responded immediately by supporting the affected people by immediate relief in the name of food, immediate shelter, and others. Recently, since the stabilization, we started the new programs. One of them, which we are extremely proud of, we have been told that there are close to 1,000 children, both in Turkey and also in Syria, that are actually born deaf. And we started the volunteer program, the cochlear implant. This is one of the largest volunteer cochlear implant in the world. And we are determined to try to cure all of those children affected. Honestly, Excellencies, when you meet those children, and I have been there actually a few weeks ago, I have met those children and their families. It is really, you can see how much tears of joy when you offer them this opportunity that they cannot afford because of their situation, whether they are from Turkey or from Syria. Another program that we are proud of, and we have completed building temporary housing units in Turkey, 2,500 units in the affected area of the earthquake, and another 1,500 also units in Syria to make it a total of 4,000 houses for the affected people. In Yemen, I'm sure all of you know about Yemen, and this is one of our largest projects. And till today, we have spent more than $4 billion, 400 million US dollars to Yemen, more than 947 projects. And we actually, again, believe that we have to support the women of Yemen. Most of our projects are either woman-focused or child-focused. We have recently started to support community support programs, to support the farmers, to support the doctors, to support actually the skills for the people so that Yemen will move from direct relief to the early recovery programs. COVID, I'm sure all of you know the effects of COVID. KS Relief has supported more than 50 countries during the COVID season with a budget exceeding 824 million US dollars. These are only examples of some of the countries that have received our aid and support, not only money and materials, but also technical and medical advice support that has been provided by the Kingdom of Saudi Arabia through the Ministry of Health. You have mentioned, Your Excellencies, the conjoined twin program, and I'm proud to be part of this noble humanitarian program. Till today, we have reached a total of 141 cases that has been looked upon in Saudi Arabia. We have a few weeks ago completed set number 61, and these children come from 3 continents and 26 countries. We have another 4 sets waiting for separation this year. We expect the first one will be in the coming few weeks. The map shows the countries where the twins come from. Most of them then come from poor families and also very fragile communities. But in addition to this picture is actually, I love it a lot. These are the twins that have been separated in Saudi Arabia. It shows actually it combines children from different countries. They carry different colors, different countries, different religions, and they are brought in Saudi Arabia with one mission, one theme, is to relieve their disability and make them useful member of their societies. And actually we have initiated this logo, which is for the twins in the middle between the 2 pictures. This is the new logo for the conjoined twins in Saudi Arabia. And the reason for that, I'll show it in the coming slide. the UN has adopted based on the request of Saudi Arabia and 70 countries to have 24th of November as the World Day of Conjoined Twins. We are proud that we are a part of initiating this day that will support families and communities who are actually have children born with this disability. And we want to increase the education for the global society so that we can help those children and try to help them not only medically, but also support them in the community and give them their rights so that they will be able to continue like any other child in the society. And in the picture, this is our permanent ambassador to the UN announcing this actually day. And because of that, His Majesty directed us to host the first ever conference on conjoined twins. This will happen on the 24th of November this year, and it will be carried on for 2 days, 24th and 25th of November. We invite all interested parties hearing us on this webinar to attend this very important conference. It will not be only medical, it will be medical, humanitarian, and also partnership building conference. And all the twins that have been separated will be invited in this conference, and everybody will be able to see the twins. They will come and actually join the people in the conference. And also, I cannot leave without mentioning an important event happening next year. We will be hosting the 4th Riyadh International Humanitarian Forum. So the Kingdom of Saudi Arabia, based on the directive of His Majesty, the King and Crown Prince, wanted KS Relief to be a hub for improving the actually impact of humanitarian work. That's why we have conducted 4 international humanitarian forums in the past. The upcoming one will be actually on the 24th and 25th of February 2025, and it will coincide with the 10-year anniversary of KS Relief. And this conference is actually highly attended forum, and we will invite our friends and partners actually from the US, from the National Council on US and Arab Relations, and also any interested partner to come and attend this conference that will actually have a high-level discussions on the future of humanitarian work. Before I leave you, I want to also mention very special programs that we have conducted with our partners. We have actually with Bill and Melinda Gates Foundation in the US and other key partners, we have determined and we have just signed recently in a global program to eradicate polio, which is the GPEI program. And our partners are the Gates Foundation, WHO, UNICEF. I was recently in discussion with actually the executive director of USAID, and she is also interested in this program, and also our partners from the United Kingdom are interested. Saudi Arabia has already supported the program with $500 million US. We hope within 5 years we'll be able to eradicate polio from the world and will make a big actually achievement. And we have already actually in the past, we have donated also for the polio eradication program in Afghanistan, the budgets that you see in front of you. But another program which is equally important is the Life and Livelihood Fund between us and Gates Foundation and Islamic Bank, and also Abu Dhabi and Qatar charity foundations, that we are trying to help 30 plus countries from the OIC organization to develop fragile and poor communities from those countries so that they will be self-sufficient. And this budget that we have injected, which is $100 million US for 5 years, and we already completed the last 5 years with 100 million, that will make our total donation $200 million US. These are the pictures of some of our 175 partners. You can see USAID is one of them, and we have recent discussions with USAID, how we can capitalize on our partnership with the United States to set a show model for a high impact humanitarian work that can be followed by others. I think my time is over. Thank you for yours, and I'll stop here.
Well, thank you very much, Dr. Abdullah, for this impressive achievement and lots of insights. And you have congratulations. You have doing this for almost a decade. I remember back in May 2015, I was present at the inauguration with Ambassador Westphal at that time. And I remember the main focus was Yemen, but the vision was to this organization become as big as Vision 2030 and as big as USAID and take it globally. And but just based on what you just said, congratulations, you have gone viral, like we say, gone global. And that's one. And also I want to congratulate you that you and your organization on reversing this humanitarian aid cycle. Traditionally, we have West providing humanitarian aid to the East, and I've seen now you're providing not only to Asia and Africa, you provided aid to Europe. You mentioned at least two countries, Ukraine and Poland. So congratulations on that. And Saudi Arabia, government, the government and people, you have a long-standing tradition of supporting those in need. And you mentioned also that since 1996, you have provided over $190 billion. That's a record that's also very, very hard to match. Congratulations. So we have a limited time to squeeze in a couple of questions. I do want to start, you mentioned Gaza. I mean, this is a topic of the day. If you notice, yesterday there was an assassination to the political leader in Tehran. So that's not going to help the humanitarian aid effort, obviously going to make it more complex. It's already hard in Gaza. It seems like everybody tried everything. I mean, you tried the airdrops, you tried some land routes, and the United States invested $230 million to establish a pier. Remember that, and that was did not bode very well. They underestimated the wrath of the Mediterranean Sea, so it did not work well. And I know you've been trying to penetrate Gaza and do more than you're doing. Could you give us just briefly on some of the challenges you've experienced in bringing those aid to
well,
Gaza?
Thank you, Canada, for the actually what you have mentioned and the compliments that you have mentioned, and what we have done is that what we believe in, and I think so determined to be working very hard to widen the humanitarian arena and also call for more funding from global partners. Now, honestly, Gaza is emotional to all of us. We have started from day one, and at the beginning there has been partial opening of Rafah corridor, so we were successful to pass through some of the convoys. But it wasn't actually easy. The challenges that we have met, first of all, the checking. Each truck has to be checked in Rafah and then goes back 50 kilometers to check again and then send it back. So it takes about 4 to 7 days to check each truck. And some of the items actually have been stopped from entering. Let me give examples which are close to all of our hearts. For example, we have been called by the health authorities that there are no incubators for the newborns. Well, incubators have been labeled as dual usage and they have been denied entrance. For example, diagnostic tools have been actually labeled dual usage and have been denied access. But that should not deter us from stopping, and that's why we insist to reach our people in Gaza. We have been negotiating with our partners like WHO and UNICEF and UNHCR and UNRWA. And then we went, as you mentioned rightly, to the airdrop program. Today, 2 ministers from Palestine were in my office, pleading for also help. We met for an hour, and they want to look other routes. We have discussed with the government of Jordan, how can we use Jordan route which is, we think, may have also partial support. And we have utilized the health facilities in Jordan, like, for example, cancer patients. We're treating them in Al Hussein Hospital in Jordan. We're treating the children in Al Istiqlal Hospital in Jordan. We're signing contracts with hospitals in Jordan, which can bring some selected patients shortly to Jordan and back. So it's not easy, it's difficult. We plea that to use the wisdom of the US and also influencers on Israel to allow opening the accesses. Nothing replaces Rafah corridor, but any corridor that can allow entrance of supplies, we plead for opening those corridors if we wanted to save lives. But I agree with you, it's not easy.
Thank you, and thank you for continuing to assist in that as well, because the people of Gaza, they're caught in the crossfire. They have really nothing to do with Hamas or the Israelis are doing in there. So I know you mentioned the assistance given inside the kingdom. I know you mentioned that briefly, and I would like to say more about it, because your program is completely different than anywhere we here in the world, and it needs to be also recognized. You mentioned that you don't call them refugees, you call them visitors. And Saudi Arabia usually criticized for not helping the Syrian refugees or other refugees in the region. But you mentioned that the visitors, which is 5% of the population of Saudi Arabia, which is a high number, and also you mentioned that maybe you mentioned, maybe not, that those visitors also they don't live in tents. They also have permissions to work and provide for their families. So could you expand a little bit on this, just to people don't know much about those aid inside Saudi Arabia?
Sure. First of all, the name, we do not use the name refugee. We use in their card visitor. And they are, and I'm sure you know, Dahouk, in the Arabic language, visitor means that has to be respected and has to be also taken care of. That's why it's been selected in their entry permit. And the government has passed very good rules for them. One is first of all, they can enter the public health system free of charge. They can also, their children can enroll in the public schools free of charge. And also they can have work opportunities. If they have special skills, they can work. And also the charity organization in the kingdom support them if they cannot work and they cannot earn money. So this is what we do for them inside. But in addition to that, we are actually one of the most well-funded organization that supports refugees outside. If you look at refugees in Jordan, we are actually the top supporter for Za'atari and Al-Azraq camps. If we go to Lebanon, I'm sure you know that how much we support the Syrian refugees in Lebanon. If you go to Turkey, we are one of the strongest supporters. In for example, Africa, in Djibouti. So we believe that refugees and IDPs deserve the attention of the humanitarian work, and they are usually forgotten in the midst of conflicts, but we should always pay attention to refugees inside the country and not forget the refugees and IDPs outside.
Thank you very much. Because again, this is such a distinguished factor for what Chaos Relief does than other organizations out there, including, let's see, in the United States, you have USAID, which is their charter only outside the United States, not inside. So with that, along with your almost decade experience with all these organizations you mentioned, could you tell us a bit about your experience working with other organizations and how you're distinguished than the others, and maybe some challenges with that?
Well, first of all, let me start with us working with the partners. I believe that partnership, whether it is country to country or actually UN or global partner together, brings nothing but benefit, because that it builds capabilities, it builds capacities, it transfers knowledge. So we have learned from our partners, such as USAID, FCDO from the United Kingdom, European ECHO, and the top 8 agencies from the UN, and other global partners. We always say to them, thank you for helping KS Relief build its history very quickly. And that's why we reach this, because of strong partnerships. In addition to that, KS Relief has become unique, and I'll tell you why. KS Relief is an organization that receives funding from the government, and it's the only organization that implements pure relief, humanitarian work for the kingdom, and no other organization except KS Relief. But also receive funding from the public, which is different. So no person, whether he is a business or she is a businessman or a member of the society, if they want to donate, they have only one route, which is through KS Relief. And the reason for that, the government didn't want those people to be subjected to liability in case their money is utilized for other purposes. KS Relief has strong governance and transparency, so the money will not be utilized for other purposes. Lastly, we do a wide spectrum of work different than others. For example, we do 13 sectors, volunteer programs, which is unique for KS Relief in the region and beyond. We do, I'm almost sure that we are one of the highest humanitarian organization that implements a volunteer program or volunteer humanitarian programs globally. I can be sure there is nobody which does more than 360 or 400 volunteer convoys a year. Those programs with the digitalizations and the new initiatives and our involvement in research have made KS Relief a new model that we believe can add value to the humanitarian arena.
Thank you. I think what you said, the utilizing or integrating the public sector into your organization, that's something very distinctive. And I think other countries may, for other reasons, might not be able to do it, but I think it's working well for you. That's congratulations on that. We talked about, I think the other key thing you're doing and close to your heart is the program CAFEC, right? The reintegration of children of war, regardless whether they're just happen to be there or some of them, like in the case in Yemen, that they were actually soldiers, child soldiers. And so that's something I think I've seen it in a decade from an idea back in 2015 and now to a full-blown program. How do you see, are you see any also other countries, other organizations? I know UN has similar program. Are you seeing also the same emphasis that you put on it from the others? You see the support from them to tackle this child soldier phenomena, or you think still not look at it as an important program, in terms of funding and recognition?
Well, if you allow me, Colonel Dahouk, let me just mention a word. I think children are unfortunate in conflict zone, and also not in conflict zone alone. They have been misused and abused. In conflict zone, they have been, as you rightly mentioned, they have been used as a child soldiers. In fragile countries and certain poor countries, they have been used in work that is not acceptable for adults, not only children, like, for example, drug trafficking, blah, blah, you name it. So this program is meant that the child has a noble life. He should enjoy his life as a child and build up his career and the career of his country. And that's why we believe a project like CAFEC is something which is unique and important, because to take those children from the misuse that have been utilized for them, whether in the army or in the drug trafficking or you name it, and try to subject them to a psychological, social, family counseling program, and you return them back to their childhood life and invest in their education. This program is actually extremely important. That's why when the Secretary General visited KS Relief, he wanted to make this program global, and there is a high committee in the UN looking at this program, and we are a member of that steering committee. And in answer to your question, are there any countries which are in the region? I'm not sure there is any other countries that is adopting it, but I know there are UN and non-UN organizations started to adopt this program, and some of them actually are partnering with us. But it is a program that I believe should be actually adopted by many countries if we wanted to protect the children of the world.
Thank you very much. As mentioned last time, this is also a program close to my heart because I was a child during the civil war in Lebanon. I've done a lot of that. Thanks God that I made it to this country with opportunities. And I hope rest of the childs out there get some kind of opportunity to excel and prove themselves. I think we have about 10 minutes to go. Maybe we'll squeeze in a couple of questions. I wanted to also talk about humanitarian aid to either Yemen or Sudan. But I know Sudan looks like nobody's looking at Sudan. Hardly any NGOs already in there, so that could be a difficult country. And Yemen, you've been working Yemen since day one, and it's also another difficult country inside to provide those aid, and probably different challenges here. So I'll let you decide how you want to tackle these two countries.
Well, you actually have pointed out that both those two countries are in difficult situation. Let me start with Yemen. Yemen, the conflict that has happened in Yemen actually has created big challenges for the people of Yemen. Number one, how there is no system, there is no policy, there is no procedure, corruption is high, you name it. But when we talk about the humanitarian work, there is always difficulties, especially in the north. Last month, I was discussing with partner UN organizations how the Houthi militias are actually capitalizing on the humanitarian work, putting dues on the humanitarian work to support the officials in the Houthi militias, and also block aid. Now they have confiscated UN staff, more than 15 or 20 of the staff of the UN. Actually, I think 17 now have been confiscated. Those acts are actually making challenges for the humanitarian actors. First, for risk. Secondly, access. Thirdly, actually, how you know that you have an impact on the ground. That's why we should always think of other ways of doing our work. We should not be deterred. We should actually be determined to override those challenges and reach the people. So it is, although now Saudi Arabia is doing a very good work to stabilize the political sensitivity, and actually last week we have heard about the agreement between the two parties in terms of the airlines and the banking system, which is a breakthrough. We hope also the Red Sea events will slow down, and the political engagement that Saudi Arabia and the UN have led will also start again to see stability, and we look for the recovery and the development rather than the direct aid. In Sudan, it's very complex, Excellencies. In Sudan, it's two parties are actually fighting for leadership, and actually the result, they are killing their own people. So what's happening is between the army and the special forces, and the fights between them, it's actually blocking the aid. And we are actually meeting on daily basis because the access is number one challenge in Sudan. I was talking to some of the Sudanese. They have lost communication. They are living in Saudi Arabia. They have lost communication with their families. They don't know where they are, whether they are alive or not, because of those challenges. Now, luckily, and this is quotes, KS Relief is respected by both parties. They believe that KS Relief is actually neutral, and that's why we have a better access than others. We cannot claim that we are the best, but at least we can reach. And we have staff as we speak in Port Sudan. We are negotiating with our partner UN and local NGOs. How can we capitalize on the trust to reach those in need? Also, how can we reach the refugees that have gone outside Sudan and try to bring for them a better and safer environment? This is the situation in both countries.
Thank you. And I think you're right. Sudan is it's more challenging, and it's close to you. I mean, it's across the Red Sea, so it's not far. And you feel like you have to do something, and it's very sad to see they're doing that to themselves, at least. But thank you for that. I think our last question is from first a quick comment on the demining. I think that's also commendable because, again, being a retired military, I'm very familiar with the mining issue. And unfortunately, United States doesn't ban the minings completely. I mean, we're still allowed to deliver aerial mines. You could drop mines from the aircraft or from artillery, so that's still allowable. And it's still allowable to introduce mines that have self-activation, so it blow up by itself at a certain time or deactivation. But the regular dumb mines are still all over the world, and places like Yemen, I'm sure Sudan will have some, South Lebanon still there. And it's and thank you for continuing to do that, because that also saving the lives of children as well. But the last question is, since we're talking to you from Washington, D.C., and I think talk a little bit about your relationship with USAID. How do you assess that relationship with them? How do you see it? Do you need to expect more or less? Just to give us insights on that. That'll be my last question here.
Well, thank you. I think the relation between us and USAID started with the history of case relief. From day one, when case relief was integrated, we have reached on the U.S. Embassy in Riyadh, and they connected us with USAID. And with the help of our foreign ministry, I visited their headquarters in Washington, D.C. And also we started to have a permanent representative in the early days from them. And they helped us to build us. I think that permanent rep left, but we continue to do exchange programs, exchange information. And 2 years ago, we have suggested, why don't we move it further and do a jointly funded program? And let's start with a pilot. And they looked at this as a good suggestion. So we have selected a partner, which is WFP. And we have done a program with them for the Rohingya minority in Bangladesh. And it was a very successful program. Last week, with actually an initiative from the executive director, Samantha Power, she actually requested a virtual meeting, and we had a very useful and productive virtual meeting. We wanted to re-stimulate this partnership, revisit our collaboration agreement. She felt that the co-funded projects is something that we should follow. And also, we should select a technical members from both sides to see how can we make our partnership fruitful and productive. So I'm very optimistic that the intention from both KS Relief and USAID is to move forward. And with this meeting, and we are planning to meet at the side events of the UN General Assembly, UNGA, and I'm sure we will reach an improved and long-lasting partnership.
Thank you. Good to hear that. That's a relationship for the world, perhaps, especially with the USAID. So with that, I mean, I see that that increased investment in development and also peace building is the only seems like a lasting solution to crisis and to prevent it. So humanitarian aid is very essential, and I think thank you for continuing to do that for almost a decade. And also thank you for joining us today. And I think we had a pretty good discussion, and I look forward to seeing you perhaps in Riyadh or at least over another Zoom call. So with that, I think our time is up. I will pass it to Del for a closing comment. Thank you, Dr. Abdullah.
Thank you, Colonel Dahouk, I appreciate it. Abbas, as always, you are just wonderful at doing this, and I can't thank you enough for your time. Your Excellency, a couple of closing thoughts here. One, when we first met together in New York and discussed the idea of what it is, actually, you were very generous. It was really more of a discussion. It was you relating to me the concept of what you're doing and what your wonderful organization is, where you're heading. And I committed to you then because I realized immediately this is much more than organizations. This is much more than politics. What you're doing versus talking about. A lot of people talk about this, and a lot of people do. And you, sir, are doing it. And it tugged on my heart immediately, in the sense that from a smaller perspective, in my family, in the Roosevelt family, we've always been raised to understand and act on the concept of, in life, when you have, quote unquote, when you've achieved yours might be different from mine, might be different from Colonel Dahouk, in the sense that what's important to you, me, a roof over our head, food on the table, the ability to raise our children, educate our children with healthcare, and parents that can participate in their life, hoping to keep them on the right track to be productive humans. You're offering that little concept that was to my great-grandfather, to my grandfather, to my father James, to myself, to my children. This is in a broad brush. You're doing the same thing by helping people who can't help themselves or prevented from helping themselves. Is if this doesn't qualify as God's work, then I don't know what does. And when I initially heard about this sitting across from you in New York, it immediately, everything else went out the window, and I viewed you as a person who has genuine passion for what they're doing. There's no politics involved. It's not a fundraising deal. It's not to elevate your own image. It is simply and purely for the benefit of humanity. I realized that at that point, walking out of the room, I considered you a brother beyond your excellency, beyond a doctor, beyond all of that. And it's made my, what I'm about to restate now that I stated then, that the National Council on U.S.-Arab Relations is with you, is with your organization. And I'd like to recommit to you now what we committed to you then, and one thing that I think that we spoke about in that meeting was the important thing here in this country, in the United States of America, for a successful result is to, yes, not you can speak at the UN week, you can talk to your blue in the face up on Capitol Hill, but the key here in this country is getting your message and your actions out and known to the people of the United States, to Americans, everybody between the East Coast and the West Coast. It's an incredibly hard task. It involves a diligent, grassroots, person-to-person effort. And that, Your Excellency, is something that, as we spoke then, that's something that we have. We have that capability to reach out to the young people of this country through our extensive and ongoing relationships for our Model Arab League program, through universities throughout the entire country, through high schools throughout the entire country. And these are the messages that we can bring as an awareness campaign as part of what we do, along with our regular programs, to let them know that programs like this exist elsewhere in the world, that are taking on in-your-face type of action to help create sustainable living conditions for humanity itself. So with that, I want to thank you, Your Excellency. I have no way to articulate how much we at the National Council appreciate you and your organization, and except to say that we are here for you. We are standing ready, and I wish you all the best. And to everyone that's viewing today, if you've missed any of this, please go to our website. You'll be able to see this. There is a link to our YouTube channel, which this is going live, by the way, over the National Council on U.S. Arab Relations YouTube channel. So you can access it through YouTube, access it through our website, and see anything that you might have missed, or maybe rehear some of the things that you heard today just to really get it. Because the message and the actions of His Excellency's organization is vital to humanity and the betterment of our future, of our total futures. With that, I thank you all again for attending. We've gone 7 minutes over. Not too bad for this group, because we continue. We tend to go on a little bit, but that's just because we feel so passionate about what it is that we do. So from the National Council on U.S. Arab Relations, I wish you all well, and God bless you all. Thank you very much.
Thank you.
for attending.
Thank you, Brother Delano Roosevelt. Thank you, Brother Abbas.